welcome to another Conversations on Awaz-e-Haqiqat that stands for the Voice of Truth. I'm your host, Chris Padra, and depending on whichever part of the world you're listening to me from, today or tonight, I am going to be talking about dental hygiene, the importance of it, and does it look any different when we talk only about South Asians, or is it a global issue that needs to be addressed more? And to talk about this very important issue, I am joined by Dr. Ritu Singh. Dr. Ritu began her dental journey in 2006 at Manipal, earning her Bachelor of Dental Surgery in 2011. She went on to complete her master's in Pediatric Dentistry from Government Dental College, Bangalore in 2015. She started her career in academia as a lecturer and has authored multiple published research articles reflecting her strong interest in evidence-based dentistry. In 2017, Dr. Ritu moved to Saudi Arabia, where she practiced for 6 years while balancing her professional life and with her role as a wife and mother of two. Her international experience broadened her clinical perspective and strengthened her community commitment to preventive care. Currently, she is pursuing her DDS at University of Washington, focusing on comprehensive prevention-centered dentistry for patients of all ages. She also maintains a professional presence on social media, where she shares insights from her clinical and academic journey. On that note, a warm welcome to you, Ritu. How are you doing?
Hi, Chris. I'm doing good. Thank you so much for that introduction. And I'm really happy to be here. And I think oral health is often overlooked. So I'm glad we are bringing it into focus today.
Lovely. Thank you so much for joining me as well, Ritu. So first things first, Ritu, I wanted to ask you that, how do traditional South Asian, oral hygiene practices, such as various things that you can think of, right? Use of oil pulling, etc., intersect with modern dental recommendations, and how can healthcare providers such as yourselves bridge these approaches effectively?
Yeah, Chris, I think this is a very important place to begin with
Mm,
because traditional practices and modern dentistry don't have to be in conflict, right?
mm,
So when we talk about things like miswak or oil pulling,
yeah.
I have actually seen this a lot in India and
Mm,
also in Saudi Arabia.
mm,
Now, the interesting thing is it's not completely unscientific.
mhm,
So when you are chewing on a miswak stick, it frays into bristles, right?
mm,
So essentially, you're creating a natural toothbrush.
right.
And yeah, and dentistry, like at its core, it's about mechanical plaque disruption, right? So plaque is that layer of that white layer that forms on
Right.
your teeth that we
Mm,
brush, right, and remove every day.
yes.
So
Mm,
if you're breaking a plaque, you're already doing something right. But here's where I think technique becomes very important.
mm,
So a lot of people just chew on the occlusal surface. Occlusal surface is that top surface of the teeth, and they
mm,
just keep biting it. So that's not enough. If you're going to use miswak, you have to be intentional about it. You have to move it along the gum line, try to reach like the cheek side, the tongue
mm,
side, angle it slightly so it can reach like interproximity, that's like in between your teeth. And
right.
I feel honestly like if you use like fresher sticks, the thinner ones, they are better because the fibers would be softer and they can slip in between teeth properly.
Right.
And the coarser ones can be abrasive. And Chris, I think that's my one caution. Miswak can be abrasive. So
Mm,
over time, especially if you're using force, you can wear down enamel. You can expose the dentine. And for most people, that's when sensitivity would start.
right.
So so yeah, if you're using something like naturally hard like miswak, I would
Mm,
absolutely recommend supplementing it with a ultra soft toothbrush. Give your
right.
teeth something gentle as well, right? And
Mm,
use fluoridated toothpaste
mm,
because fluoride would help remineralize the enamel. Use flock. Miswak won't replace flossing. Okay.
right. Perfect.
Yeah, and if you talk about like oil pulling, I
Mm,
see that more like an adjunct.
mm,
So the concept isn't completely foreign to dentistry. There are some mouthwashes, like modern mouthwashes, also that contain
yeah.
oil,
Mm,
but it's not a replacement for brushing and flossing. I think
mm,
it is more like a mouth rinse. Yeah,
right. As an additional supplement,
as an additional,
complementary. Yeah. Yeah.
yeah,
Got it.
adjunct. Yeah.
Perfect. Now, thanks for that good start, Ritu. But I'll move on to the next one, which is, we have certain cultural beliefs when it comes to community per community. What are those specific cultural beliefs that can act as a barrier to professional dental care, and how can these be respectfully addressed in community health initiatives?
Um, So I think the one that I have heard a lot is
Mm,
like that scaling would loosen my teeth.
mm,
And I always smile when I hear that because I understand where it's coming from.
mm,
So what's actually happening is, there is plaque that sits on the teeth for a
mm.
long time and then it
Yep.
calcifies and then it turns to tartar.
Mm,
And tartar doesn't just sit lightly on one tooth, it
mm.
starts connecting multiple teeth together.
Right.
So in some patients, it almost like acts like a splint, like
Mm,
splinting all those teeth together,
mm.
especially that happens in your lower front teeth and the upper back teeth,
Right.
because those are the areas where our major salivary glands are. So more
Mm,
saliva, more minerals, and then more tartar buildup.
right.
Now, the key part that people don't realize is that tartar is full of bacteria, and
Mm,
those bacteria cause inflammation that would result in bone loss, right? So
mm,
imagine if a tooth, like there is a root, and that used to
mm,
be fully surrounded by bone. But
mm.
over time, now maybe half of it is actually supported by bone, and
Mm.
rest is held by that tartar. Now,
Right.
when I remove that tartar during scaling, right? So you would feel that the tooth is loosened now. But the
Yeah.
scaling did not cause that looseness, right? The disease did. Yeah, so
I
tartar was
understand.
just hiding it. And then the
Mm.
bone loss will continue, and then you would eventually like lose the tooth. So then if you do deep cleaning, the gums
Yeah.
do tighten over time, the
Mm.
inflammation will reduce, right?
Yeah.
And so you shouldn't just avoid scaling just out of fear that the tooth would become mobile.
Yeah.
Um, I think education is very important.
Absolutely.
Visual aids can help. Like you can
Mm.
show patients radiographs, like see
Mm.
this is the bone and see this is how it lose. So if you provide them with visual aids and all these things,
Yeah.
and tell them that cleaning makes doesn't make teeth lose, and
Mm.
it will
Mm.
remove the disease which was
Mm.
already destroying that support, right?
Right. Right.
So and
Agree.
and yeah, another thing that I wanted to talk about was the
Mm.
preference for the same gender dentist, right?
Mm. Mm.
So I think that's very cultural and
Right.
it varies.
Mm.
Personally, I have practiced in North India, South India, Saudi Arabia. I haven't frequently experienced refusal based on gender, but I completely understand why some patients may feel more comfortable with the provider of the same gender, right? Because
Right.
I think dentistry is invasive. We work very close to the face, neck, and
Mm.
sometimes the chest area during positioning. It's intimate space. So, like, instead of dismissing that preference, we should normalize it. We can
Right.
offer choice where possible.
Mm.
And I think even simple steps like having an assistant present in the clinic when you're working with the
Yes.
patient,
Mm.
that can help. And you should explain every step before touching the patient and ask consent. Just say, like, I'm going to adjust your head. Is that okay? So that
Mm.
builds trust immediately,
Right.
right?
Yes.
And
Absolutely.
another thing that I want to say is ergonomics. Ergonomics play
Mm.
a role. So here, where I'm training right now, I
Mm.
use loops,
Mm.
dental loops, and it allows you to sit upright and maintain a good working distance. So working distance is like the distance from my eye to the patient, right?
Right.
And that reduces patient discomfort, and it's also good for the dentist because their precision
Mm. Yes.
increases, right?
Absolutely.
So yeah, so I would say like education to correct
Mm.
the myths about scaling, use visuals and all, and normalize preventive care. So
Mm.
not just going to the dentist when your tooth have actually become loose.
Yeah.
And yeah, and then also create culturally sensitive environment where
Yes.
like patient
Mm.
feel respected and comfortable to go
Absolutely.
to a
No.
dentist. Yeah.
Absolutely. I agree with you totally. But when you talk about awareness, right? So I know that we need more awareness on this issue because most of
Yes.
us are very scared when it comes to visiting the dentist. But some of the other issues clubbed with this is language barrier, like when we come to talking about South Asians or migrants, right? What
Mm.
role do health professionals, what role do they play in, kind of
Yeah.
removing this barrier of language and overall helping in improving oral health knowledge?
I think they play a very important role, Chris. So
Mm,
I think we have to start with something very practical.
mm,
Like, I think not everyone regularly sees a dentist, but
yeah.
almost everyone at some point sees a general physician.
Mm-hmm,
And that's where non-dental professionals become incredibly important. Now,
mm,
sometimes it's not about giving a lecture on bone loss, it's just
mm,
simply saying like, when was your last dental checkup, right? Just
Yes.
asking this
Mm,
question. That
mm,
can normalize dental care as part
mm.
of overall health.
Right.
Because, yeah, many people still see mouth as separate from body. They'll
Mm,
manage diabetes, blood pressure, heart conditions, but they'll ignore bleeding gums, right? So if
mm.
physician reinforces that gum inflammation can affect systemic health, that carries weight.
Right.
So physicians don't need to explain the mechanics behind it. They just need to connect the dots, guide the patients
Mm,
in the right direction. So I see their role more as directional and reinforcing.
mm, mm,
And when we talk about community leaders, I think we are talking about trusted voices, right?
mm.
Like that could be religious leaders
Mm. Yeah.
or
Yeah.
school teachers,
Yes.
local elders. Yeah. So I think if a respected leader says, like, take your child for their first dental visit by age
Mm.
1, or don't let a child sleep with a milk bottle. I mean, I think that carries weight and people
Right.
would listen.
Mm.
Another thing, I think talking about prevention is very important. It's very similar to when governments have like vaccination
Yes.
campaigns.
Mm.
So when you are emphasizing vaccines, that means you're talking about prevention, right?
Mm.
So we need
Yes.
the same normalization for oral health because see, the reality is even dentists get cavities because the diet today is full of carbohydrates and
Mm. Yep.
sugar.
Yes.
So instead of like blaming, I think we should focus on early detection and prevention.
Mm.
And when literacy or language is a barrier, I think we should simplify the message. Again, use visuals, use
Yes.
local language
Yep.
pamphlets, school programs, community talks.
Mm.
We just need to repeat simple, like preventive advice from trusted people.
Right.
And so, yeah, so I don't see non-dental professionals as secondary. I see them like as essential partners.
Mm.
Yeah, because I think oral health doesn't always begin at dental clinic. Maybe
Absolutely.
it begins sometimes in a physician's office. Yeah.
Absolutely. You raised a very important point, Ritu, and that's where I will kind of put in my next question because it's kind of related, that everything is related, right? So we often
Yeah.
see that there's a strong link between oral health and systemic diseases like diabetes or cardiovascular health. Um, how can this integration of oral health screening into general health checkups be better implemented? I won't say promoted because we've talked about awareness, but how can we merge the two for better implementation?
Hmm. Um, so yeah, I think that is there is definitely a strong link
Hmm.
between oral health conditions and cardiovascular
Yeah.
diseases. Like in India, there's a very common saying like the way to a man's heart is through his mouth. And traditionally, it means like good food wins affection. But
Yeah.
medically speaking, like if your mouth is chronically inflamed, you have
Mm,
bacteria in it that definitely can enter bloodstream. So even
mm,
something as simple as eating food or brushing,
mm,
can make these bacteria go into the bloodstream, affect blood
right.
vessels, and that can contribute to heart disease,
Mm,
something like infective endocarditis.
mm, mm,
So, in a real sense, the health of your mouth does influence the health of your heart. Now,
mm,
how to integrate it into general health checkups? I think first thing would be to normalize it. Like if
mm.
someone is coming for a diabetes check or say blood pressure check or just for like a annual physical,
Yep.
I think a quick look inside the mouth should be a
Mm,
part of that exam.
exactly. Mm,
So if somebody is coming to me
mm,
for say pain in the tooth, I am always doing a head and neck screening. That's like part of my exam. I'm always doing a oral cancer screening. So in the
right.
same way, I think normalizing a oral exam should be a
Mm,
part of a physician's visit as well.
right.
And just checking like do you have any like are there any bleeding gums or loose teeth, any
Mm,
ulcers which are not healing?
yeah.
And just asking them like when was your last dental visit? So
Yes.
these small steps, they
Mm,
bridges like medicine and dentistry.
absolutely.
So I see we are already integrating like eye exams for diabetes and
Mm,
like kidney function monitoring. So I think oral health should also be viewed in the same way.
mm,
And I think another way could be like sending simple public health messages. For
yes.
example, like just saying healthy gums, healthier heart,
Mm,
or say
mm,
like your mouth reflects your health. So this way we shift the mindset from like dentistry is optional to
yes.
oral health is part of medical health. So
Mm.
then the integration becomes normal. That's
Easier.
what
Absolutely.
I
Perfect.
think.
But on that note, Ritu, one thing we often hear, maybe many of us have experienced, that dental care, if you're residing out of the country, is not very cheap. It's quite expensive, right? And if you don't
Yeah.
have the proper insurance, it can be out of pocket. How can we subsidize the cost that is associated with regular dental checkups or getting an X-ray done, or all the cost that is associated with a dental appointment?
Um, it's a very important question, Chris,
Mm,
because I think we approach dental costs from the wrong angle.
mm,
Instead of asking why is dentistry expensive, we should ask at what stage are we paying?
right.
Because the cost of dental care increases directly with the severity of disease.
Mm,
Now, a cleaning is inexpensive.
right.
Filling would cost more. Then
Mm,
comes the root canal crown, which costs significantly more. And if you
mm,
go for implants, that would cost even more. So
yep.
financially, it makes sense for, I think, if we are talking about government, to
Mm,
invest at the preventive stage.
right.
That's the model I strongly believe in, a prevention-based public health financing.
Mm,
If governments fully subsidize preventive services, especially
mm,
for children and adolescents, you reduce the
right.
number of people which are progressing into this high cost advanced disease.
Exactly. Mm,
So, and also prevention is predictable,
mm,
affordable.
yes.
Advanced treatment would be complex and costly. So,
Mm,
from a policy perspective, I would recommend first universal coverage of preventive dental care for children up to age 18. And
mm,
second, continued subsidy of preventive services for adults, even
right.
if complex
Mm,
restorative procedures are only partially covered. So,
mm,
like, that's a financially sustainable model because you're investing early to
yes.
avoid exponential spending later.
Later. Yeah.
And another major access model, which I think is underutilized, is dental colleges and
Mm,
teaching hospitals. So, dental schools are actually powerful public health tools, and patients receive, like care at significantly reduced cost.
right.
All the students who are there are supervised. And since it is
Mm,
an academic environment, there is very strong oversight and ethical
mm,
accountability. And no
mm,
one in that setting is incentivized to overtreat, right, for profit.
yeah.
They're
Yeah.
just, the goal is just like education and patient care.
Mm,
So, yeah, I think firstly, there should be a shift of funding towards prevention and
right.
subsidize the early care and
Mm,
also make use of teaching institution because the real financial burden in dentistry that comes from delaying the treatment.
right. Perfect.
Yeah.
I want to shift the focus towards social media, Ritu. So when we talk, we are all over social media, right? In fact, this generation
Yeah.
is widely on social media. What
Yeah.
role does technology, or can technology for that matter, and social media play in disseminating targeted or culturally appropriate oral health information to various communities?
I think honestly, social media is where people go first and not to
Mm,
the clinic. Like even before patients walk into a dental office, they've
yeah.
already Googled their symptoms, watched YouTube videos, scroll down like Instagram reels, and even ask like AI tools for
Yes.
diagnosis.
Mm,
And as a dental professional, we are seeing that shift. I have personally seen like viral videos claiming that cavities can heal naturally with certain mixtures. I have
wow.
like personally seen that,
Mm,
and we have to be very clear here.
mm,
Like at early stage, caries can sometimes be remineralized with
mm,
fluoride, but
right.
once a true cavity forms, meaning the enamel has broken down and there is an actual hole, that cannot grow back on its own. Enamel does not regenerate that way. It
Okay.
requires professional restoration.
Mm,
But when someone says, DM me for secret remedy, and thousands of people are engaging with that content,
mm,
it tells you how powerful social media
right.
is, right?
Yes.
So I think technology is like a double-edged sword.
Yeah. Yeah.
On one hand, like misinformation spreads fast, but accurate information can also spread if we use it correctly. Um, how can we make it culturally appropriate? I think many people understand health concepts better in their native language. So I think if
Mm,
the content is available in multiple languages, um, that should be helpful.
yeah.
And second, I think cultural context matters. For example, as we talked about before, like miswak
Yes.
and oil pulling, I
Mm,
think
mm,
a culturally sensitive read could say, like, yes, you can continue this, but here's how you do it safely and
mm,
you know
mm,
what you should
mm.
add.
Yeah.
So that
Yeah.
kind of builds up trust. instead of resistance.
Mm.
And I think also using the platform, like in South Asia, more people use WhatsApp groups or community Facebook
Yes.
pages or
Mm.
local influencers. So if we partner with community leaders or
Mm.
local doctors to share like short evidence-based messages, that
Mm.
could have real impact. And also, I feel the professionals, like the dental professionals, need to show up. If I think if the qualified dentists don't create content, that vacuum will be filled by someone else, maybe
Right.
someone who is just selling a product, right?
Yes.
Yeah.
Absolutely. No, perfect. I totally agree. The way social media consumes you, sometimes you feel that, oh, I have every information here. Why would I need to
Yes,
consult a professional? And that's where,
exactly.
especially for the young generation, who are very impressionable.
Impressionable. Yes, yes,
But
right.
Ritu, on a personal note, you don multiple hats, right? You're a mom of two young ones. You have a professional side. So much is happening in
Yes.
your life, right? On a difficult day, how do you take care of your mental health?
So Chris, after dealing with a lot of like
Mm.
multiple difficult days,
Mm.
I have learned to do one simple thing,
Mm.
stay in the present.
Right.
So I have recently moved countries. My husband and I are both students again, and we have two
Mm.
kids. There's a lot of uncertainty about
Right.
future. So
Mm.
so I focus on today, what I can control
Lovely.
today, what is the
Mm.
one thing that I can do well today. I don't try
Mm.
to solve my whole life in one sitting anymore.
Mm.
Um, and I think for me, mental health is about not letting my mind live in places I cannot control. One
Mm.
day at a time. That has been my biggest coping strategy. I just try to live this day responsibly, peacefully, and that's all.
Absolutely. Absolutely. I could not agree more. But one last thing before I let you go, Ritu, what would be your message to our listeners and where can we find you on social media?
Okay, so if I could leave you with one message, it's this. Normalize visiting the dentist even when you're not in pain.
Mm.
Dental care is not emergency care, it's preventive care. It's okay to go for a cleaning, for a routine check. Just stay ahead of your problems,
Mm.
right? So, yeah, and for social media, I am on Instagram. Um, my handle is Dr. Ritu Singh.
Mm.
So, yeah. So you can find me there, and I'm open to having communication or talks
Lovely.
in whatever topic. Yeah,
Thank you, Ritu. This was such an informative and a heartwarming and an open-minded discussion because I think many of us we dread going to the dentist, but that is so very important. We only realize when the tooth starts aching, right?
yes,
Um, Thank you so much for giving me your time. I know it's a busy day, and for you as well, it's a busy day as well. To our audiences, this was Dr. Ritu Singh. She spoke all about oral health, the importance of visiting to your dentist before something happens. It's about preventative care. And if you've heard it for the first time, I hope you liked what you heard. And if you have any comments or if you want to reach out to her, I'll be posting the links. You can talk to her directly. And Ritu, thank you again for joining me. I hope we can have many of these conversations in the future.
of course, Chris. Thank you so much for having me, and I really enjoyed this
Thank
conversation.
you.
Thank you.